Thanks for clicking on this interview. If you don't want to watch a full 30-minute movie, go down in the description and all of the topics and questions we discussed are indexed. Click on the blue hyperlinked time and it'll fast forward you in the movie to that particular question or topic. Thanks very much for watching and enjoy.
I have had more success in reversing high blood pressure, diabetes, coronary artery disease than I ever did with medications.
On the first episode of Prescribe Plants, we are speaking with Plant-Based Cardiologist Jami Dulaney. So let's get started. We have Jami Dulaney. You're a cardiologist from Port Charlotte, Florida, and about a half hour north of Fort Myers. Am I about right there?
Yes, that's absolutely correct.
Terrific. Tell us a little about yourself and how did you find this lifestyle, the plant-based lifestyle?
I guess I first was trying to keep myself healthy. I have a strong family history of cardiovascular disease and my grandparents, so I took up marathon running thinking that if I stayed slim, that I wouldn't get diabetes. But I noticed that my cholesterol was starting to sneak up, and I took statins for a while. I had some of the same issues that my mother did. But anyway, I ran across A Diet for a New America by John Robbins and decided to go plant-based, and then subsequently Forks Over Knives led me to want to do it in my practice.
That book is on my list of books to read. I'm a patient, and let's say I'm plant curious or I've never heard of this lifestyle. How would you summarize a whole foods plant-based lifestyle to someone who's never heard of it before, one of your patients?
I often start with, there's a way we can fix this through nutrition. And there's a way that plants and vegetables and fruits can really help you. So this plant-based nutrition that I'm talking about is any vegetable that you want to eat, any fruit that you want to eat, and as much quantity as that you want. You can have whole grains such as rice, barley, quinoa. You can add all that to it. Potatoes are great, white potatoes, sweet potatoes, any of those. But what we do try to avoid is animal products, meaning beef, turkey, fish, poultry, and oils. And so I over time, I try to start with what we do as opposed to what we don't, because that really scares people off.
How does this lifestyle then affect those diseases? How does it affect chronic diseases and why?
I have had more success in reversing high blood pressure, diabetes, coronary artery disease than I ever did with medications. And the main way it works is that by eating plants, specifically green plants and plants, dark green leafies, they produce nitric oxide when they combine with our gut microbes and with amylase, and that releases nitric oxide, and the nitric oxide dilate or enlarge our blood vessels, so we get so much more blood flow to the rest of our body. And it's not like the big blockages go away right away, but those tiny blood vessels, those feeders, look, if you think about like roots in the ground, start to dilate. And so people's chest pain go away, their blood pressure goes away. When we get them off processed food, the salt in consumption goes down, so their blood pressure goes down. So we can make some big changes pretty quick, and that's very motivating to people.
Absolutely. And I heard you mention a few chronic diseases, but can you just again name the chronic diseases in your clinic that you personally have seen reversed by people just simply changing their diet and lifestyle?
The first one is high blood pressure, high cholesterol, diabetes, coronary artery disease, claudication in the lower extremities or cramping, when you walk. Diabetic neuropathy is improved. I've stumbled across a couple people with cancer that their cancer is kind of gone into remission just as give this a shot. So it's almost psoriasis goes away. Arthritis, aches and pains get better. There's just a whole host of positive side effects.
Absolutely. That's great. What, kind of a two-part question. We'll go with this first. What holds people back the most from starting?
Change. How do I cook this? It's not the way I'm used to. Typically I may have a husband and wife in the office, and they kind of look at each other. The cook is, oh no, what am I going to have to do to change cooking? Will my family, do this? And then the second thing is social. Here in Florida, people go out a lot, they socialize, so they're very worried about losing their social connections.
And how do you, if I'm a patient, I say, I do all the cooking in the house, I just don't think I could do this. How do you still, without being too heavy-handed and too pushy, what do you say to them? How do you encourage them to just try it? What are your tips?
What do you find? I start with, what do you do now? So the question that I ask every day to every patient is, what did you have for dinner last night?
Okay.
And, so if it's a baked potato, if it's steak and a baked potato, then I have the baked potato to go through, or I may have a salad and a baked potato. So I hang on to those. And so what other vegetables do you like? And, so if I can find some common ground and give people, and it's like, okay, well, this is what I had for dinner, or this would be how I would change what you had for dinner to make it plant-based. And, do you like soup? Yes, I like soup. Well, this is how to make it plant-based. So once they get a little glimpse that it's not going to be all that hard, they're not willing, they're willing to give it a shot.
Terrific. As a doctor who prescribes this, what some would say, radical treatment to chronic diseases, why are you in the mind? You even said that you've treated more chronic diseases with this plant-based, with nutrition, than you have with medicine. Why are you still in the minority? Why haven't more people heard about this?
It takes time. It takes time. You have to sit down with people and spend time, find out where they are, find out how they got where they are, and then gently help them along. And it's not a I have a little prescription pad that said watch forks over knives, and here's my podcast, and these are 4 or 5 books that you should read, and I give them that. But if I just gave them that, I could even give them the book, and they're not going to read it, because I've tried that with our meetup group, that we're going to even discuss the book, and people will come with the book, but they won't ever have read it. So it's that you need time to be able to explain it and help them along. And frankly, a lot of doctors don't have the desire, but again, because they want to eat the same thing as our patients do for the most part. So, it's hard for me to tell you to go eat plants when I'm going to go home and have a steak. There's a belief system. People just really don't want to believe that something as simple as nutrition can do this. And, quite frankly, it's a lot quicker to do a procedure and it's a lot and prescribe a medication and go on to the next room than it is to, talk this way. But, things have got to change.
So and that's another question that I wanted to talk about in the overtime section, is because you are speaking to patients for a longer period of time, educating them about this thing that really works, like it works. How have you managed to spend that extra time with a patient while also keeping in mind your practice and you have to get to all the rest of the patients?
First of all, my practice is a little different. I'm a solo cardiologist, so I set my own hours and my time slots. So I do. So I actually allot for a new patient to have that 30 minutes. I'm glad your dog barked first. So I do set more time per patient than, say, a primary care that's got to see 50 patients. I may only see 15 in a day. So right then and there, I have more time to see them. I've selected my practice to do that. I've discussed with primary cares, how you could tackle this in a team approach. A lot of people have nurse practitioners, and they may have access to ancillary personnel. There's a way that you could get that going in your office and kind of divide and conquer. But I think, I really do think it's a disservice to somebody to try to see somebody in 10 minutes and help them. It's just impossible.
That's an interesting perspective. I like it. I'm a patient. Dr. Dulaney, I've heard a lot about this low carb and eating lots of protein and fat, and I've heard of some people who've really lost a lot of weight doing that. How would you reconcile the beliefs of those who are passionate about high carb, low fat, plant-based lifestyle and the low carb, high fat lifestyle that contains animal products? How do you speak to people who bring that up?
Well, first of all, ask them, how's it really worked? Have you really lost weight and kept it off? Because most people rebound very quickly. And I start with, our bodies were meant to use carbohydrates. Our muscles function using carbohydrates. Our brain functions almost solely on carbohydrates. So our muscles really want that. Mm-hmm. The other thing is that protein is so hard for us to metabolize. It's so hard on our kidneys. When people get to be about 65 years of age, they've lost a third to a half of their kidney function. And metabolizing proteins is so hard. And then I bring up, the China study. We know that places that eat the most protein have the most cancer, have the most heart disease. And then I bring up this, it's like, I know this way works, and we have data to show that before and after, we can see reversal of coronary artery disease. We can make the diabetes go away. The studies are there. Unfortunately, the low carb, yes, we can make you lose weight on a low carb diet. Certainly can. You can lose weight on cocaine. You can lose weight on chemotherapy.
Yeah.
But it's not the healthiest way to go.
True. That's a good way of putting it. And this is such a powerful way of doing medicine. Have you ever seen this lifestyle hurt anyone or any negative side effects? How can it go wrong?
I haven't seen any negative side effects. I've had a few patients that were on the thin side lose weight. Maybe those people lose a little bit more than they want to lose. And it's just a matter of talking with them. It's like, okay, eat some more carbohydrates. So eat more potatoes, eat more rice.
Getting more calories in. That's great.
Yes.
What one piece of evidence or information would you give the most hardcore opponent of plant-based medicine?
Look at the countries that eat the most dairy: Great Britain, Norway, United States. We have the most breast cancer, prostate cancer, osteoporosis, and some of the worst health care despite the money. Look at the countries that eat vegetables and rice. They have some. Look at the blue zones. They eat vegetables, rice, whole grains. They live longest. They live best.
Well said. And let's say a patient doesn't want to go cold turkey, and you sense that that's the kind of patient who is just not going to go cold turkey. If you were to offer just one simple piece of advice to that person who wants to get healthier, what would that be?
Let's make one change today, whether it be breakfast and go to oatmeal and blueberries, or can you add some more greens to your diet?
Do you tend to say add the good stuff instead of take away the bad stuff, or is it both?
I start by adding the good stuff. So let's add the good stuff and shrink the bad stuff. Mm-hmm. So we're not going to take it completely away. But could you have, maybe you take meat out of breakfast, mm-hmm. and then meat out of lunch, and then decrease your portion size. Mm-hmm.
And then so really, if you say add some oatmeal, that might even subconsciously and automatically take the bad stuff out, because once they have a cup and a half of oatmeal with some berries, they're full. They're not going to want to eat the eggs and the sausage and the bacon.
Right. And we have to make oatmeal not your grandmother's oatmeal that was cooked to somewhat of a paste on the stove, if you can remember that. So, I tell them how I eat my oatmeal. It's like, okay, it may be, dates and raisins and walnuts. One day it may be apples, and I may add apples. I may put blueberries. There's always some fruit in it. There's always something, cinnamon, to spice it up. So it's not just plain overcooked oatmeal. Try refrigerated oatmeal. It can be cold. It doesn't have to be this laborious on the stove for hours and hours of paste.
Good point. This next section I'm going to call the lightning round. These are fan submissions from the video that I made and you shared of, hey, we're interviewing a plant-based cardiologist, and some people did write in. I can reiterate and say kind of what's on your mind. What Dr. Dulaney, the advice that Dr. Dulaney is giving you should not necessarily be considered medical advice from your doctor. Okay, make sure if clear these things with your medical professional. Did I kind of say that right? In other words,
yes, absolutely. I can't give advice to somebody that I haven't really seen. That's not just general.
Okay, very good. So this first person says after 10 years on a statin, he or she went off it, became whole foods plant-based, no cheating, very little oils, only plants, more exercise. After 11 months, blood work showed that LDLs rose, HDLs dropped. triglycerides went up and particle size worsened. Have you ever seen this happen? And can you give some sort of feedback on what may be going on there?
There's usually always something. It takes a lot of detective work to identify what went wrong. People's LDL won't go up on a whole food plant-based diet. It just doesn't happen. What I typically find is that people go out to dinner. Mm-hmm. They're given a lot more oil than they think they are. They're eating packaged foods that there's a lot more oil, hidden oil, just like, marinara sauce can have 30% fat in it. So there are these things that are there that people aren't mindful of. Mm-hmm. It's not their fault. It just sneaks in and you don't realize it. But sometimes I have to sit in my office for 30 minutes with somebody and I'll find it. I'll eventually find it. It could be crackers. Somebody could be just eating a bunch of crackers, trying not to eat bread.
Sure. Okay. Very good. So be a little bit more mindful of everything that you're eating and go over everything with a fine-tooth comb. Let's see. Can you speak anything about, have you seen any regression or improvement of asthma on a plant-based diet at all? Any research out there?
Certainly. Even consuming beets, which produce nitric oxide, so the beets themselves, besides the beet greens, actually has been shown to improve the walk test in people with chronic obstructive lung disease, and it's through nitric oxide production and increased blood flow. So that's for sure. And then, of course, getting rid of the dairy will decrease the inflammation in the lungs. We know, and we're starting to know so much more about the gut microbe and how it increases, it has a potential to either increase or decrease inflammation. We have macrophages or white blood cells that are ready to, mount a full force offense on our body at any given time. And that happens a lot with asthma. There's a lot of inflammation. So by decreasing the inflammation through decreasing dairy, people get a lot, have a lot of benefit.
And if you were to describe in broad brushstrokes, you said our gut microflora, and that's kind of a hot topic issue these days, is our gut microbes. If you were to give us a general sense of how are we slaughtering our gut microbes and making the problem worse, and how can we make it better? Can you just summarize that for us?
I talk about it in terms of a garden because I like to garden. And so if you have a vegetable that you planted or seeds that you really want to grow, but then you don't water them and you don't nourish them and provide, and they don't get the sunlight they need, you never reap any crop from that. Mm-hmm. In the same way with our gut microbes, if we want to select for good gut microbes, we have to feed them, and their favorite food is fiber. Okay. So we have to have a high fiber diet in order to sustain our gut microbes, the good ones.
And fiber, by definition, is only found in plants. Is that correct?
Absolutely. Okay,
good. Just to make that clear, because I just watched a movie recently by Dr. Greger, who I'm very excited to say agreed to an interview in November. He said that he had a study that said half of people believe that steak is a significant source of fiber. It's funny. Can you touch on sodium and heart health, and then I guess two-part, sodium and heart health, and how eating a whole foods plant-based diet can unclog arteries?
So the first question is sodium or salt. And we know that salt is actually directly toxic to the blood vessels, so it stiffens the blood vessels. And when our blood vessels become stiff, we lose that compliancy. The normal blood vessel is a very pliable rubber band types, hose that's very soft. When you eat salt, it makes it more stiff. The other thing it does is when you eat salt and you take it into your bloodstream, it causes you to retain water. So now you have this stiff blood vessel that's having to, being forced more fluid in. So it's like overfilling the water hose, so to speak. So that leads to problems, as well. And as far as reversing heart disease with a whole food plant-based diet, our bodies are a wonderful thing. If you take away the toxins and give it a chance to heal, it will. Mm-hmm. And by nourishing our body with vegetables that help to produce nitric oxide and improve the blood flow, and taking away the toxic substance that cause free radicals and oxidation and inflammation in our system, your body can heal. And so those plaques that are raised that cause blockages will gradually settle down, and start to, the blood vessel become wider. And we know from physics that if you increase the flow, if you increase the diameter by 1, you increase the flow by 4. So just a little improvement in the diameter of a blood vessel really increases the flow of blood, which increases the flow of oxygen and nutrients to our body.
Terrific. So this is a little bit more specific, having to do with a medication. This person was prescribed diclofenac for a muscle strain, and their blood pressure went up. Do you have any other recommendations? I'm assuming they're asking any other prescription or painkiller recommendations, or it could be natural for a muscle strain.
Well, we know that non-steroidals and medicines such as that actually will decrease healing. It takes away the pain. Sure. But there's actually there's been some association with more tears. So it's, if you have to compete in an event, if you're a football player and you have to go back out on the field, certainly giving a non-steroidal will, get you back in the game, but it's not going to help you heal. So to help you heal, we want to decrease the inflammation. And we know that spices such as turmeric, ginger, they have some of the properties of aspirin, salicylic acid, they're broken down to, but there's a bunch of other processes that have the anti-inflammatory capabilities of those medications without the side effects of them. So, I again, like the approach that, we're going to, the rice method, as so you're going to ice it, you're going to, and let the body heal itself and pay attention to your bodies and then use these natural things to decrease inflammation.
And what I tell my athletes in high school and in college, I make it very general, and I say that we have such an emphasis on protein these days, is they think, oh, I have a muscle strain, I need to eat more protein. Well, you do need protein, absolutely, for healing, but I say eat more fruits and vegetables. Is that okay for healing too, eating your fruits and vegetables?
Absolutely, because when you eat the fruits and vegetables, you're decreasing inflammation, but you're getting protein. I always tell people if you eat a banana, you're getting a gram of protein.
Sure.
So, if you eat the calories, you decrease the inflammation by not taking in toxic substances, you're going to heal a lot quicker.
Great. I think we're going to end it there. Dr. Jami Dulaney, thank you very much for your time. I know your time is valuable. We'll keep in touch, all right, Dr. Dulaney?
All right, sounds good. Thank you very much for your time.
Thank you, Jami. Bye-bye.
Okay, all right, bye-bye.
And are you, what workouts do you have coming up for your triathlon?
Well, I just, I'm glad you're a trainer because now I'm going to make you pay for this. I just quit I only did 11 miles of my 20-mile run today because both my calves started cramping up. I have some sore Achilles. Yesterday, swim, bike, run, I have an Ironman in 3 weeks. And so it's been pretty, I'm up toward the peak of my training. Yeah. And so yesterday I had some heels on. What else did I do yesterday? I also had a 5,000-yard swim with about 1,000 yards of kicking that I had with fins on. Oh. So I think the combination of shortening my Achilles with that and then putting heels on yesterday evening to go to dinner. Yeah. And then I tried to run. And I run in flats. I run in the Ultras. So they're a zero drop shoe. Yeah. And I've done all my training in those. And I'm just, I like, light flat shoes, but it really, I've got some sore Achilles right now. So are you the mindset of ice and room temperature stuff, or what's your, as far as I'm stretching, rolling now, and
yeah, it's funny, orthopedic world, I guess we're moving. There is an increasing body of research that's moving away from just ice because they say that the body's inflammatory process is there for a reason. And although you want to limit that to a certain degree, you still want that to happen to aid in healing. So for sore Achilles, I would say stretching, hanging your feet off of a stair, and just gentle stretching. And again, if you were an athlete coming in to see me in the AT room, I would say eat your fruits and vegetables, stretching. You can apply ice, but maybe eat once or twice a day. Don't go overkill for that. And if you need to at this point, if I were you, I would much rather get a day or two of rest in at this point than keep pushing it, and then in 3 weeks you have Achilles tendonitis.
Yeah, that's I've been down that road where I've really got my Achilles irritated, and so that's kind of why I pulled the plug today at 11. Last week, at 7 miles, it was tightening up, and I actually walked a little bit, and then it completely loosened up, and I never had any discomfort at all. But today it just wasn't loosening up, and I was like, no, I'm not gonna risk it. I'm gonna rock.
This is a full triathlon you have?
Yeah, it's a full Ironman distance.
Full Ironman.
So, tomorrow I have a 100-mile bike ride, which usually, down here in Florida. And the other thing is, it's hydration too. It's so hot.
Yeah.
It's 90 degrees by 10 o'clock. But so hopefully, biking doesn't seem to bother too much. So I'll beat myself up on the bike and maybe lay off on the fin work, Monday swimming.
Yeah.
Because that tends to aggravate things a little bit, I think.